How do you tell if shortness of breath is asthma or COPD? Imagine trying to breathe through a straw or feeling like your chest is tightening with every breath. That sensation can be caused by different lung conditions, but how do you know which one? When you experience shortness of breath, it's important to understand the differences between asthma and chronic obstructive pulmonary disease. Both affect your lungs and airways, but they behave quite differently and have unique signs. Asthma usually causes episodes of breathing difficulty that come and go. You might notice sudden attacks triggered by things like exercise, dust, pollen, or cold air. Between these episodes, your breathing can be perfectly normal. The attacks often feel like a tight chest, wheezing, or a whistling sound when you breathe out. Asthma symptoms tend to start early in life, often in childhood, and can run in families. They are usually reversible with inhalers or bronchodilators, which open up your airways quickly. Chronic obstructive pulmonary disease, on the other hand, causes a steady, ongoing shortness of breath that worsens over time. It is most common in people over 40 who have a history of smoking or long-term exposure to irritants like fumes or dust. And like asthma, the symptoms of COPD do not go away and tend to get worse even with treatment. People with COPD often have a cough that produces mucus, especially in the mornings, and this productive cough is a key sign. As the disease progresses, you might notice a bluish tint around your lips or fingernails, called cyanosis, which indicates low oxygen levels. The triggers for symptoms are different too. Asthma attacks are often caused by allergens, cold air, or emotional stress. COPD symptoms are usually worsened by respiratory infections or environmental pollutants. When it comes to lung function tests, asthma symptoms can often be reversed quickly with medication, showing that the airway narrowing is temporary. COPD involves permanent damage to the lungs, including destruction of tiny air sacs called alveoli and inflammation of the airways, which cannot be fully reversed. Another key difference is oxygen levels. During severe asthma attacks, oxygen levels may drop temporarily, but in COPD, low oxygen levels are more persistent because of ongoing lung damage. If you are unsure, a healthcare provider will perform spirometry, a test that measures how much air you can breathe out and how fast. This test helps distinguish between the two conditions by showing whether your airways are blocked temporarily or permanently. In some cases, people can have both asthma and COPD, a condition called asthma-COPD overlap syndrome. These individuals often have more frequent symptoms and need a tailored treatment plan. Knowing these differences helps ensure you get the right treatment and manage your breathing better. If your shortness of breath is persistent, worsening, or linked to a smoking history, it's time to see a doctor for proper diagnosis and care.